Alrighty, let's go on to the second part of the lecture here. Now we're just going to go into movements. So this is knee flexion, which is bending or decreasing the angle between the femur and leg, characterized by heel moving towards the buttocks. You have extension, which is straightening or increasing the angle between the femur and the leg, so knee extension, just like that. Now, neither will occur unless flexed to 20 or 30 degrees, so you get a little bit of external rotation. So see how the foot goes out? That's external rotation. Okay. Rotary movement of the leg laterally away from midline. This is internal rotation. So remember, the tibia needs internal and external rotation. If you get excessive internal and external rotation, then you can get meniscal injuries, ACL injuries, etc., etc. But you need a little bit of that for normal movement. Now for the muscles. Well, you know about the quads. They extend the knee, located in the anterior compartment of the thigh. Consists of 4 muscles. You got the rectus femoris, Vastus lateralis, Vastus intermedius, Vastus medialis. Yeah, you know, that's why I wear baggy pants, just to cover these thighs up, you know. This is ridiculous. Look at this. Vastus medialis, rectus femoris, Vastus lateralis, sartorius, calves. All right. The Q angle, now this is very interesting. This is the central line of pull for entire quadriceps, runs from the ASIS, right there, to the center of the patella. The line of pull of patella tendon runs from the center of patella to the center of tibial tuberosity. So that's the Q angle there. Angle formed by the intersection of these two lines at the patella is the Q angle. So you see this Q angle right here? Now, the Q angle is the angle formed from ASIS to the center of the patella. Okay, so this is how you would measure it. Okay, females have a larger Q angle that makes them more susceptible to knee injuries. So that's why working on your glutes, such as glute medius and glute max, is very important for ladies, because you're more susceptible to knee injuries because of a greater Q angle. It just puts a little bit more torque on your knee. Okay, normally this angle will be 15 degrees or less for males and 20 degrees or less for females. Generally, females have higher angles due to the wider pelvis, and dynamic Q angles vary significantly during planting and cutting exercises. Okay, make sure you know these landmarks here. So normal is about 15 degrees. If you have greater than 20 degrees, you get these knock knees, and if you have less than 10 degrees, you get bow-legged. Okay, so you see how the toenails are painted, so it tells you that females are more susceptible to this Q angle variance here. Higher Q angles generally predispose people in varying degrees to a variety of potential knee problems, including lateral patellar subluxations or dislocations, patella compression syndrome, chondromalacia, and ligamentous injuries. And that's why females and knee pain are very common. So if females like to run, then they're going to get lateral patellar subluxation, dislocation, patella compression, chondromalacia, and ligamentous injuries more so than males are. So the hamstring muscle groups are responsible for knee flexion and located in the posterior compartment, and strong hamstrings will decrease the injuries associated with higher Q angles. So ladies, working on your hamstrings and glutes is very important, more so for females than males. The hamstrings consist of 3 muscles: semitendinosus, semimembranosus, and biceps femoris. Okay. The Popliteus muscle assists medial hamstrings in internal rotation of the knee, so that's might be a good quiz question. 2 joint muscles, most effective when either the origin or the insertion is stabilized to prevent movement in the direction of the muscle when it contracts. So muscles are able to exert greater force when lengthened than when shortened. And all the hamstring muscles, as well as the rectus femoris, are biarticular or 2 joint muscles. So again, muscles are able to exert greater force when lengthened. The sartorius muscle, total length increases as it becomes more effective at flexing the knee when the pelvis is rotated posteriorly and stabilized by the abdominal muscles. Exemplified by trying to flex the knee and cross the legs in the sitting position, where one usually leans backward to flex legs at the knees. So football kicking invariably leans well back to raise and fix the origin of the rectus femoris muscle to make it more effective as an extensor of the leg. So see how it becomes. Okay, so you'll lean back this way. Okay, so you're lengthening it, and as you lengthen it, then when he goes to kick it, it'll become more powerful. So boom, boom. Okay. The gracilis, sartorius, and semitendinosus join together distally to form the pes anserinus. Good quiz question, might be on the exam. Attaches to anteromedial aspect of the proximal tibia below the level of the tibial tuberosity. This attachment and the post-medial line of the pole enable them to assist with knee flexion, particularly once the knee is flexed and the hip is externally rotated. A lot of times females will also get, it's called pes anserinus bursitis, or irritation, and again it goes back to weakness in the hamstrings. The medial and lateral gastroc heads attach posteriorly on the medial and lateral femoral condyles respectively, assist with knee flexion. The knee joint locations, primarily on the anterior side, knee extension, rectus femoris, vastus medialis, vastus intermedius, and vastus lateralis. Posterior side, what primarily flex the knee? You got biceps, semimembranosus, semitendinosus, sartorius, gracilis, popliteus, and gastroc. The femoral nerve innervates the knee extensors, rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius. The sciatic nerve, the tibial division, innervates knee extensors consisting of semitendinosus, semimembranosus, biceps femoris with a long head. The common perineal or fibular head supplies the biceps femoris with a short head. Quadriceps are obviously vital in jumping. They function as decelerators, meaning slowing down when speed needs to be decreased to change direction. Body needs to be stopped when coming down from a jump. Eccentric contraction during decelerating actions controls the slowing of movements initiated with previous. Remember, if you have weakness in your quads and you can't eccentrically control, that's when you run into problems and knee issues. So who has the highest vertical jump in the NBA? Michael Jordan, Zach LaVine, James White, Shannon Brown, Muggsy Bogues, Vince Carter, Andrew Wiggins, and Nate Robinson. So show you this video that you can appreciate some of the best NBA stepped up. Can't wait for the NBA season to come back again. The rectus femoris, which is a two-joint muscle, vastus medialis, vastus intermedius, and vastus lateralis, which is the largest. Okay, all attached to the patella and then to the tibial tuberosity via the patellar tendon. They're all superficial and palpable, except the vastus intermedius, which is under the rectus femoris and a lot deeper. Strength or power may be indicated by vertical jump test. Okay, generally desired to be 25 to 33% stronger than hamstring muscle group. Okay, so that's that ratio that occurs, the 3-to-2 ratio. Okay. Strength and endurance are essential for maintenance of patellofemoral stability, which is often a problem. Quads are particularly prone to atrophy when injuries occur. Okay. Now, going back to the strength thing, this is very important, probably on the. What happens is your quads are usually a lot stronger than your hamstrings, sometimes 50-60% stronger than your hamstrings. If that's the case, then you're going to overpower, you're going to become quad dominant, and you're going to not do well in squats, deadlifts, whatever the case may be. You'll be okay with lunges or any quad dominant exercise, but that's not good. Okay, so you want only your quads to be only 25 to 33% stronger. Quadriceps may be developed by resistant knee extension activities from a seated position. Functional weight-bearing activities such as step-ups or squats are particularly useful for strengthening and endurance. Okay. Rectus femoris muscle, flexion of the hip, extension of the knee, anterior pelvic rotation. Vastus lateralis, extension of the knee. Vastus intermedius, extension of the knee. Vastus medialis, extension of the knee. Hamstrings, semitendinosus, semimembranosus, and biceps. Ooh. Hamstring muscles. Strains are very common, referred to as running muscles because of its functional acceleration. Antagonist to quadriceps, named for their cord-like attachments. Anyone that's hurt their hamstring, they know that it can be quite painful and takes a long time to heal. Hamstrings all originate on the ischial tuberosity, good quiz question, of the pelvic bone. Semitendinosus inserts on the anteromedial side of the tibia, and semimembranosus inserts on the posterior medial side. Biceps femoris inserts on the lateral tibial condyle and head of fibula. Here's the semitendinosus, flexion of the knee, extension of the hip, intra-rotation of the hip, intra-rotation of the knee, posterior pelvic rotation. Semimembranosus, flexion of the knee, extension of the hip, intra-rotation of the hip, intra-rotation of the knee, posterior pelvic tilt. Biceps femoris, flexion of the knee, extension of the hip, intra-rotation of the hip, intra-rotation of the knee, posterior pelvic tilt. Here's that Popliteus muscle. So it does flexion of the knee, and it does internal rotation of the knee as it flexes. So as it bends, it'll internally rotate that knee. After total knees or ACL injuries, I have found that clients and patients have tightness in their popliteus. So if you work it behind the knee, a lot of times it will relieve their knee pain. Knee extensors, rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis. Agonists, biceps femoris, semitendinosus, semimembranosus, and popliteus. Okay. Knee internal rotation, agonist, semitendinosus, semimembranosus, and popliteus. Knee external rotation, agonist, biceps femoris. All right. So just going over all that. Hopefully you can go over these and help you prepare for exam number 2. You guys can go ahead and take that. Good luck.